You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. We're talking about full mouth reconstruction with San Diego's go-to dentist when you have severe dental problems and bad teeth and gums. With us, we have Dr. Aldo Espinosa. Dr. Espinosa, welcome to the program.
Hey, Randy. Thanks for inviting me. I'm really excited to be here, and I appreciate you having me here and helping us spread our word to the community.
Okay, good. Now, I'm not trying to side with you, but I told you this off camera. I go to your website. You got videos on there. It's a great resource for learning a bunch of things, and you also have a lot of patience. And I watched a few of the videos, and I mean, these people, because when we talked on the phone, it sounded like an exaggeration how you say, Randy, we're changing people's lives and things like that, but it's real, I guess, at your office.
Yeah, for sure. I mean, it's always easy to read, that doctor, that dentist, oh yeah, I do all this thing for all these people, and I do this and that, but at the end of the day, the real proof is when you have actual patients talking and showing it to other people. So,
Good.
Videos and real testimonials, that's what really speaks about your word, not me saying it to you. Let other people talk about it, and then you let me know if it's true or not.
Okay, good. Now, I know you brought a stack of photos, but for people that don't know your practice, I mean, who's the typical patient you see?
Okay, so we don't have that one typical patient. So we see patients from all walks of life. I mean, we see people from their 30s to all the way to their 90s.
Okay.
So, but one thing I tell you, all these people that we see that seeks us for our help, everybody has the same common characteristics. They all finding or looking to be better. They're all looking to feel better, and they're all looking to be happier and really trying to enjoy life like they used to enjoy it before they had, all these issues with their teeth. So that's really the typical patient that comes through our doors. Somebody just wants to just feel better about themselves. That's really what we normally get. But that being said, if I had to categorize the patients that we see, I can really categorize in three groups.
Okay.
Group number one will be the patients that already have no teeth. The patients that are wearing just full dentures, full all fake teeth, whether they lost their teeth 30 years ago or they lost their teeth 6 months ago. The end result is the same. They're just struggling with painful and ill-fitting dentures. So fake teeth, that's group number one. This first group of people, those people struggling with dentures, they come to us and we basically get them fixed with a set of permanent teeth in one single day. So they come to us in the morning and we grab their dentures, put them in the trash. Honestly, put them in the trash.
Is that right? Okay.
We put them in the trash, yeah. I mean, because that's what it is for us. But they walk out of the evening in the office with a full set of permanent teeth in their mouths, being able to eat whatever they want.
Very nice.
So that's
very nice.
That's group number one.
What's the next one?
So group number two. Group number two are the patients that have had all this whole bunch of trouble in the past, and they've already been told by somebody else that they are going to lose whatever amount of teeth they have left.
Okay.
So whatever they have left, they're just going to lose them. So the group number two will eventually fall into group number one.
In a denture.
Well, not with us.
Okay.
There's no way in this world that will end up in a denture with us, but eventually they're gonna end up with no teeth. Okay. So same thing, these guys, I mean, if this group number two comes to us before they were a denture, they're kind of in a lucky situation because, we can get them to bypass, all this, hassles of wearing something removable. So we basically bring these guys from losing their teeth, unfortunately, but we set them up with same thing, a full set of, we use implants for this, so we use them a full set of teeth, put them in the mouth, so same day.
Nice.
We take out whatever doesn't work, we put the whole set of brand new teeth in one day. So, group number two is a little bit luckier than group number one because, they saw us in a little bit better time.
Okay.
Now, from here, we jump to group number three. Group number three is not quite in group number two. So these guys, this is a really special group.
Now this is the full mouth, and by the way, for people just tuning in, we're talking about full mouth makeovers. We're talking about full mouth reconstruction. So this third group, I interrupted you. Describe them.
So, okay, yes. So this exactly, I mean, there's 100% what you're saying. This third group, there's a full mouth reconstruction group. What they have, this is your typical patient that has been struggling, for the last 10, 20 years. They have been going to 10 different dentists. They've been going like 20 or 30 appointments already throughout their life, so all these 20 years. They had multiple root canals which failed at the end. They had all this work that is just not eventually working. So they are going to miss some teeth, but they're also not ready to miss them all. So
they're not quite ready for a full mouth of teeth to be taken out.
No, they're not quite ready for that. They're not quite ready for that. So they have something that is fixable. So, and that's good news for them also, because we can get them. They have moving teeth. They have infections here and there. They have bad breath and teeth that are starting to shift here and there. So they're really self-conscious. They don't go out so much. They don't feel so good. So. Third group, what we do, those are full mouth reconstruction people. So we do a combination of things for him. We take out whatever is not good and we replace him with some implants here and there. So for these people, we do a combination of procedures. So they are going to be missing some teeth, because they've already been through a lot of things, but we are going to keep some other teeth. So we replace the ones that we're missing with some implants here and there. The ones that we are going to keep, we clean them, we remove every infection, we fix their gums, their breath, and eventually we fix those with, whatever they need, whether it's cosmetic crowns, bridges or veneers, or whatever we need to do for them to keep what they can keep, but still end up with a beautiful smile that they can really, do this, around people, and also use it, function with it, eat with it, and just feel comfortable.
You believe that a smile, you say, can transform somebody's life.
I wholeheartedly believe it. I can say I believe it 100%. But the thing is that I can believe whatever I want, so, I can believe anything I want. But when you see it on people, when you actually realize what you can do, then that's really powerful. So yes, and
you get choked up, by the way, just even talking about it.
I do.
Good for you, because it is life changing for these people.
It's life changing, and like I said, it's they're like Peter Parker. With great power comes great responsibility. So when you have the power to change somebody's life, you also have responsibility. To perform, to deliver, and to let those people know what you can do.
Good.
Yes, I get choked about it.
Good for you. Good for you.
So when you ask me about, if I believe it's life changing, I'm gonna go back like 15 years ago. A long time ago. I guess one of my first patients when I started my practice. So we had this guy. This guy, probably in his 50s, mid 50s, tall guy, white hair and everything. He came to us, one infected tooth. So we have one infected tooth. He walks in the office, not really energetic, kind of like that. And hey, we see him, we take care of him, we take the tooth out. And I notice a lot of problems going on. So I go, hey, mister, whatever, come back next week. I'll see you in 2 weeks. Let me check everything, see what's going on. He comes back. Long story short, we build rapport, we build trust, and we end up doing a full mouth reconstruction for him. Yeah. So before this, his demeanor was, kind of not a lot of energy. I'm gonna put it this way, not a lot of energy. He was like that. Mouth, was full, missing teeth, infected teeth, broken down teeth, everything. He didn't smile, big mustache going here and everything. So he was hiding everything. So remember, I was younger back then. So I didn't have so much experience. I didn't realize what I could do. So I just wanted to just do it for him. Just wanted to do it. So then I started working, and then as we saw him throughout the process, when he started looking better, started getting, and actually we did some implants for him, one of my first implants 15, 20 years ago. Some veneers, some crowns. So I go, this guy, next time he starts walking into the office, he starts walking a little bit taller. A little like that, it's a little bit shaved, and then eventually he starts talking, hey, I got a new Harley. So this guy now is buying new motorcycles for himself. So a couple of months later, he walks in there. Now he has a new girlfriend. So you see everything that happened after what we did for him. Because of his self-confidence. It was a different person. You brought some photos. What are we looking at? Yes, I did. Let me show you. So let me show you this one. This is the first one. every photo I got, I got a really strong connection to it. Every single patient, I really have really high connections to them because of what we did for him, the changes they've gone through. But let's talk about this first one first. So, you see, if we look at the before picture for him, this guy's really nice guy actually. This is really nice guy.
Yeah.
But when you look at his before picture, you can see that all his teeth were broken down. Actually, we had a really hard time. We kind of forced him to smile for the picture because we need a smiling picture so we can do our smile design and everything that we need to do. But this guys, we need to really force him. It's like 5 times, smile, no, really smile, and no, and then we have let's do a smile contest. So, to begin with, he didn't even want to smile for the picture, even though it's something private.
Yeah.
So he smiles for the picture. Now we can see that has all his teeth are broken down. If you look a little bit closer, there was some infected stuff.
So what did you do for him?
Yeah, for him, we did also a combination of procedures. We did a full mouth reconstruction, and
the after looks good.
Well, the after looks actually, you can look at the after picture, but it's just a picture. But if you want, if you allow us, we also have some video of him, when we finish his work. So if you can show that.
You brought that's right. You brought the video. Let's go to the video.
Yeah. Challenge. When was the last time you did this?
I can't even remember. You ready? I haven't had that one in a long time.
How does it feel?
Feels great. Wow. Wow. That's excellent. Thank you. That's wow.
Thank you for trusting me to do this for you.
You guys are great. Are you kidding? Best experience I've ever had is here. Thank you for the dance.
It's very nice.
Yeah, and pictures are really good, but to me, videos are even better. And I wanted to show you and Aris these videos because here you can really see how he actually looks, when he's smiling, when he's moving, and more important, you can see 2 things here. You can see how he feels.
Yeah.
You can see his energy. You can see how happy he is with this. And the other really important thing to me is you can actually also see what he can eat with those. One of our famous tests is an apple test, because an apple is something that is traditional, classic, biting into an apple. But
so people with bad teeth can't really bite into an apple.
No, they can't.
Because it hurts, or they might lose a tooth.
Well, there's maybe it hurts, and the other one, if you have loose and infected teeth, well, it hurts. You cannot do it. Don't even say if you have a pair of dentures, and there's no way. They just move. Then there's no way in this world you're gonna bite into an apple like that with a pair of dentures. So, all these patients, my goal is always the same. Make them look way better, of course, and feel better about themselves. But also, I want them to be able to eat, the things that we all like. And the things that we all like is always the same. Do you want a nice piece of steak? Most everybody wants a nice piece of steak. Do you want to eat corn on the cob? Corn on the cob is a classic. Do you want to eat some ribs? This guy wanted to eat beef jerky.
Okay.
Hey, beef jerky. I love beef jerky. But yeah, of course. Yeah, we can get you eating beef jerky. So, all these different foods that they stay away from. And how they stay away from unconsciously. They just stay away from it. Now they just don't eat them because they go into other stuff. So
is this one of those things where you do this full mouth reconstruction and with a combination of procedures, and they say, I should have done this years ago? Is that the regret a lot of these guys have?
You know what? All the time. Honestly, all the time. That's it is always a regret that everybody has not doing it earlier. But at the end of the day, whenever they told me, oh, I regret doing this, not doing it before, it's always, you know what? Don't worry about the past. Don't worry about the past. We're here now. Now you're done. Forget about whatever happened before. Just, enjoy from now on. So, now let me show you another one.
All right.
Let me show you another person. So, look at this. Just when you look at her before picture, and just looking at the picture right now, look at her. Oh man, I remember the story. I mean, I remember her perfectly when she walked into our door. I mean, she was really, really self-conscious about herself. She didn't want even me to take a look at her teeth because she thought that everything was gonna fall out just by me looking and touching things. So she didn't want even me to take a look in there, let alone, you know, wiggle something or whatever, because she thought everything was gonna fall out. So,
Okay.
you know, imagine her not even wanting me to take a look at it. Do you think she wanted other people to look at her teeth? You know, she wanted to go to, you know, for friends or family or to barbecue or something? No, I mean, they stay home. You know, they don't go out.
Because you say people with bad teeth oftentimes don't smile, so you don't even see like I never see people with bad teeth.
Yeah,
It's because I guess they don't smile.
they don't smile and they don't go out, and they're embarrassed about it. I mean, they're really embarrassed. They're embarrassing with me, and I was
Even with the dentist,
even with the
interesting.
dentist. I go, you know what?
Like they're ashamed of themselves.
yeah.
And these people, you say, in some cases, are brushing and flossing and gargling.
No.
But they have a bacterial infection.
I mean, I see a lot of these people that, and there's another story, and unfortunate thing about them, they feel so guilty. They feel so guilty, and they come to me feeling guilty, and they say, "No, yeah, I'm brushing, I'm gargling, you know, I'm flossing 3 times a day," and they feel it's their fault. But it's really, I mean, at the end of this, it's really not their fault. I mean, they just have, different bacteria that won't.
So you
go
clear up
away.
the infection in their mouth.
Oh yeah, 100%. We clear up. Well,
So with her, what do you do?
so.
It looks nice, the after.
Just look at her smile. I mean,
She looks happy.
Yeah, she looks really happy. I mean, we didn't force her to smile like that. I mean, she just smiled. I mean, she was feeling better. And same thing, you know, we did a full mouth reconstruction, combination of procedures for her, implants here and crowns there. But at the end of the day, whatever we do, whatever procedures we use, the end result is the same. You know, I want you to feel good, and I want you to feel better about yourself. Either way we do it. That's what we're looking for. So we're gonna go to another one.
All right.
Now let me hand you this one. We always try with our initial workup with patients, so I can really see what we can do for them. We always need a whole bunch of pictures. I always need somebody to smile for a picture.
You couldn't get her to smile?
We're gonna get her to smile, man. There was no way. That she wouldn't smile. I mean, not even in our safe zone, not even in our office, not even for the dentist. You know, we couldn't get her to smile. So, and that's fine. You know, it's just one thing that we couldn't get together. We knew we were gonna be able to fix it eventually, and we did. And
Looks nice.
Fast forward to her after. Now she can't stop smiling. And she's actually a really nice lady. You know, she hugs. She brings things to us. You know, she brings food and all this stuff. Because most of these people, all of them, they're really appreciative. You know, at the end they feel better, and you know, every time they come for their maintenance or whatever, you know, they always bring little things, and we also feel really good about it. You know, because when they feel good, we feel good. Okay, so one more.
All right.
And this is a really good one. Because this guy, I mean, he's a young guy. You know, he was a young guy. I mean, good-looking young guy and everything, but same thing. You know, he had gone through some issues. You know, in his life, he wasn't feeling so good about himself because his smile wasn't really there. You know,
Okay.
I mean, his smile he didn't want to show his smile. I mean, you can see it on his before picture. You know, his teeth were broken. You know, there was a whole bunch of cavities here and there. So, same thing. You know, he found us. We interviewed each other because, you know, I'm not only interviewing them, you know, they're interviewing me. You know, it's really important for them to. So all these patients, this is really important for them. Remember, they've been through a lot.
Okay.
They lost a lot of hope, and they lost a lot of trust. So they really don't trust dentists anymore because, you know, a lot of things hadn't worked before. You know, so now they lost trust, they lost hope and everything. So when I see them, you know, of course, you know, I see them if I can help them, but it's important that also they feel that I'm the good person to help them, you know. So yeah, we get to the point, you know, we agree that we're a good fit for each other, and then we do the work for him. And like I said, pictures
Very nice.
speak 1,000 words. Look at the after. Now, I'm gonna go through a little quick story about this. It's a funny story. So we were making his smile design. You know, everything that we do is, you know, computerized and all these software programs, full digital and everything. So we have, you know, like hundreds of different smile designs. Then if we get to the point, we get to customize, you know, freehand the smile design. So he had a really special request, and you know, his special request is getting Tom Brady's smile.
Tom Brady's.
Tom Brady's
teeth.
Tom
Okay.
Brady, 7 Super Bowl winner Tom Brady's smile. And you go, you know what? All right. So, you know, we got Tom Brady's picture of Tom Brady. You know, we saw his teeth. We figured out how his teeth were, how they were shaped, and then we replicated Tom Brady's smile. So, you know, one of our patients has Tom Brady's smile.
3 minutes left, and I know you have a lot more photos, so I'll rush you a little bit.
Come on, 3 minutes for all to showcase all the people. Okay, let's go. I mean, this guy. Before picture, you know, actually, you know, somebody that actually agreed to smile with his before picture. Same thing, you know, broken teeth, infected teeth, combination of procedures. You know, we get him from the before, we get him to the after, and just look at his smile. He looks like a brand. Everybody looks like a brand new person here. And now something. Look at his after. I mean, even though his teeth look so nice, he's still not smiling all the way.
Like big. He's not smiling big yet.
Yes, because most of them are not used to smile anymore. You know, they're used to hide their smile for so long. Okay. Their muscles are need to be trained. So it'll take him, you know, a while. It'll take him like 10, 15 compliments from other people for him to realize that he doesn't need to hide it anymore. You know,
that's nice.
He can do this now, and they'll get there. Everybody gets there. Everybody gets there. So okay, maybe right. 2 minutes.
Yes.
Okay, another young guy. See, another young guy. I mean, everybody here has the same story. You know, a lot of cavities before, a lot of broken and infected teeth. You know, multiple, you know, failed attempts at the dentist before. So same thing, you know, we met him, built some trust, we took care of them with a combination of procedures, same things, and then you can see he's after. This is a really nice guy. We took a lot of pictures.
Very nice.
Actually showed me he's also new motorcycle. You know, he went to the office, the doctor's going to come on down, let me show him a new motorcycle.
Got a new motorcycle.
Of course, he was a new person. He got a new motorcycle.
Good.
Yeah. Another one.
So that's her smiling on the before.
Smiling before. Yeah,
they just hide their smile.
That was her smiling for. I mean, and just really nice person. I mean, this is a really nice person. She has really good vibes. I mean, you know, she's appreciative, happy, well, as happy as she could be. But you can see it on her before smile. Even though she's a really good person, she still didn't want to show her teeth. Yeah, and after.
Very nice.
Now look at the after picture. I mean, she now wear more makeup, you know, better smile, you know, taking care of herself more. Look how her teeth follow her lower lip line, you know. I mean, that's really one of the perfect smile if you put it in a textbook, you know. And we didn't do it by accident. I mean, everything that we do it by smile design. You know, everything is by
like their
design.
face goes in a computer?
Oh, well, man, we'll talk about technology one, but yeah, we do have, you know, an actual, you know, full face scan. When we take, you know, I scan your face, and then our designer, smile designer, puts your face on the computer, and the smile gets designed on your actual face, not really, you know, on,
that's nice.
On a model.
Okay.
It's actually wonderful. One more patient. I mean, look at the before picture. There's also a really nice person, really successful business person. This guy, I mean, he's like, I think like 6'8" or maybe more. He's like huge teddy bear, man. But you know, he was struggling with teeth. You know, he comes to our office. Same thing. We build trust. We get him to the process, combination procedures, and
looks good.
Man, he looks wonderful. He's a happy guy also. He's a happy camper. How much more time will you have?
About a minute.
1 minute. Okay, so another guy. I mean, it's actually a really special person. I mean, his wife is our patient. His wife went through full mouth reconstruction with us, and then, you know, eventually, you know, he got her husband. I mean, he, you know, pushed for.
She forced him to come in.
He forced him to come in. Yeah, of course. You know, he forced him to come in. Really busy guy, successful business guy. You know, a really outgoing person. But you know, he wasn't really outgoing on his smile, and I guess the wife wasn't happy about it. You know, he wasn't really smiling. So, you know.
Is this like done in one day? Most of these that you've showed me today?
Everything that you see, we do in 1 day.
Okay.
Everything that you see, we do in 1
And
day.
I guess the main thing is because you have all the lab, you make the teeth, you do everything right there. Is that right?
100%. 100%. We do everything. We do everything in house.
Is that the new trend in dentistry? Like what would take like 2 specialists, 3 specialists? Now, I've even had an oral surgeon said, Randy, they got these new super specialists. It's not a real thing.
Yeah.
But do you consider yourself like that? Able to do all these different things?
I do consider myself like that, because we are able to do, all these specialty procedures in-house in the same.
These full mouth reconstruction cases, what would take other people, and we talked on the phone, what would take others maybe 10 months through several visits, you could do it in a few visits.
100%. I mean,
like 2 visits.
Yeah.
Okay.
Yeah. And besides, let alone the 2 visits, I mean, the speed and the quality of what we can do. Imagine everything gets customized. I mean, it's not like it used to be that, whatever your teeth were sent out to made, they had, like a 5 different set of teeth to choose from, No, we don't do that now.
It's customized.
100% customized. Customize to your face, to your smile,
Nice.
or to whatever request you have. I mean,
now insurance, even the best dental insurance really doesn't cover these type of procedures. Medicare, Medicaid doesn't cover it, but you say people are financing it, like more and more, really?
Yeah, of course. I mean, we have a whole lot of different ways that people can afford this. We have different jobs here. One of our job is, of course, have all this specialty training so I can really deliver the work that you need. But also another job is to find a way to make it reachable and affordable to you. Either we can. So yeah, most people finance this work, of course.
Good.
Yeah.
So we're out of time. Final message to a person, they've heard what you had to say. They have really bad teeth, bad gums.
Yeah.
But they're still skeptical.
Yeah.
They're like you said, the person that can't get themselves to do it. What do you say to them?
I would say the same thing, and we understand, you're skeptical, and we understand the whys. I mean, this is a story that we've seen, 100 times, and we understand it. But the only thing that I would say to them is, give it one more shot. Just find the courage again, give it one more opportunity, and if it's just come on down. Just come on down to the office, pick the phone, make an appointment, or just come on down, get to meet me. Just get to meet us. I mean, you don't need, we're not going to do anything. We're going to yank any teeth out. We're not going to do anything. I'll just get to meet, see if, I'll talk about what you need. We talk about different options. We're not going to do anything in the first day anyways. We're just, let's talk about it. Let's come on down. We'll talk about it. You feel good. And let's see, just move forward a little bit. So,
good. I want to thank you for coming on the show. Good stuff, by the way. Thank you.
Appreciate it, man. Thank you.
So if they go to the website, they can see that you also have a huge Instagram. You got tons of patient reviews that are good. So good stuff.
Yeah. I mean, just go to the internet, go to social media, go to wherever you want. I mean, like
because you're all over the place.
The proof is on our patients.
Good.
I mean, don't listen to what I say. Don't listen to what I'm talking about. Just look at the patients. Look at those, and there's no better proof.
Very nice. Thanks for coming in.
You're welcome.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.